for coming. My name is Karolina Gwoździewicz. I'm a doctor. I work in the Department of Pneumology and Cystic Fibrosis. It's a part of Institute of Tuberculosis and Lung Disease in Rabka-Zdrój in Poland. My department is headed by Professor Henryk Mazurek. I hope that nothing unexpected happened and Professor is listening us today. Together with Katarzyna Warzeszak, physiotherapies, we are happy to have this chance to tell you about improvement in physiotherapy in patients with cystic fibrosis during exacerbation. I'm going to tell you the story of 70-year-old boy with cystic fibrosis, a boy who has rapid progression of bronchopulmonary disease for about 2 years. There are some facts in his medical story that I'd like to inform you first. The diagnosis was made in the first year of life. The most common mutation, delta F508, was detected in both alleles or CFTR gene. And for years, the progression of the disease was rather moderately progressive. The course of disease was rather moderately progressive. This boy suffered also from pancreatic insufficiency, exocrine pancreatic insufficiency, which is typical for classic cystic fibrosis. But unfortunately, despite adequate enzyme supply, despite hypercaloric diet, there is constant long-term malnutrition. Furthermore, the eating problems are aggravated and complicated by insulin-dependent cystic fibrosis-related diabetes, and most of all by late diagnosed Asperger's syndrome with coexisting anxiety disorders. And what about imaging? You can see here the chest X-ray performed about 12 months ago. There are generalized bronchiectasis, very advanced bronchiectasis, and lung hyperinflation. In numerous microbiology lab tests, Staphylococcus aureus was detected since early childhood. Occasionally, other bacteria were detected, and first isolated Pseudomonas aeruginosa was last year, and fortunately, the eradication was effective. And now, let's move back to the main problem and focus on the rapid progression of the bronchopulmonary disease during about 2 years. Here is the graph in which FEV1 and FVC values are recorded. The rate of decline of these parameters is very worrying. For about 2 years, there are exacerbations requiring intravenous antibiotic therapy and hospitalization. And sad to say, but despite targeted antibiotic therapy, despite successful eradication of Pseudomonas aeruginosa, despite nutritional treatment, gastrostomy, there is no improvement in spirometry parameters. Of course, the recovery was observed. Recovery, I mean improvement in lab tests, in good general condition of the patient, for example, withdrawal of auscultatory changes over pulmonary fields, but there is no improvement in spirometry. Please take a look. For example, this first dot is the FEV1 measured on admission, and the second dot is the FEV1 measured after approximately 14 days of treatment. This situation repeated 3 times. Since June 2019, we haven't noticed, we haven't detected any, since June 2019, FEV1 and FVC haven't come close to pre-exacerbation. And another slide. Of course, during this exacerbation and at home, the patient continued physiotherapy, continued nebulization. And I'd ask my physiotherapist, Katarzyna Warzeszak, to tell a few words about it, about the details.
Okay, so far our patient respiratory physiotherapy was as follows. In the morning, the patient was given hypertonic saline 5% after first inhaling formoterol. In the afternoon, inhalation was carried out using pulmozyme, and in the evening, the inhalation was repeated in the same way as in the morning. And drainage twice a day using device with positive expiratory pressure and oscillating PEP. Of course, this was after saline. Drainage time was about 50 minutes. In addition, our patients sometimes go cycling and walking in the mountains.
Okay, so what's happened further? During the last exacerbation, we had to change something. We had to do something new because, as I have just presented, the previous treatment was insufficient. And especially that the last exacerbation was the most serious of all. On admission, the patient has had very high inflammatory parameters. He was very weak. He stopped eating completely. His mood was depressed. There was severe anxiety and helplessness. Because of coexisting anxiety disorder, that patient only focused on his loss of appetite, only on permanent glycemic control, like in obsessive compulsive disease. He didn't worry about his poor expectoration. Even he didn't notice it. And then we realized that it could be one of the reasons that there is no improvement in spirometry. That could be a reason that our previous treatment was constantly failure. You can see here on this graph that on this exacerbation, FEV1 and FVC values fell more than 50%. And remembering the bad prognosis observed during the previous exacerbation and the bad prognosis observing the trend of spirometric parameters during last months, there was a real risk that after this exacerbation, the FEV1 and FVC won't improve again. So despite we were afraid of difficult cooperation and of our patient because of Asperger's syndrome, we decided to use Simeox to try it. And now I ask Katarzyna to tell you a few words about the physiotherapy.
Since it was the first time the patient had such a severe exacerbation and a decrease in spirometric values in a short time, we decided to modify the current physiotherapy. The physiotherapy was modified in the following way. Twice a day using the Simeox device and also a device with positive expiratory pressure, which the patient has been working with for several years. A brief look at the physiotherapy. On the first day of hospitalization, we implemented the Simeox device. After each cycle, during the break, the patient worked on positive expiratory pressure, drainage time 20 minutes twice a day, Simeox device settings, power 25 and 50%, power cycles 4. Drainage was initially carried out only in a sitting position due to the fact that our patient has anxiety disorders that prevented relaxation and hence also the chest, which is very important during drainage, because when we want to go down to the residual volume, the patient should be able to relax the chest muscles. And in this case, was possible only in a sitting position. It was the most comfortable position for our patient. Apart from this, despite the anxiety disorders, from the first attempts, the patient tolerated the device well and was willing to repeat the next cycles. We noticed that our patient was able to expectorate a larger volume of secretion for the first time. From the achieved results, we want to distinguish first of all, noticeable effect of cleansing the bronchial tree without effort, which is very important, especially during exacerbation. While working on Simeox, which we have worked on many times, our patient was able to focus on the task of concentration during drainage. I think that the most important elements from the perspective of physiotherapy are those from the patient's point of view, i.e. commitment, motivation, and willingness to take part in physiotherapy of the bronchial tree. The feelings of our patients are also very important, namely a positive impression and easy noticeable, objectively measurable effects of treatment contributed to the increase in faith in the effectiveness of therapy and also became an incentive to continue conscientious pulmonary rehabilitation also at home.
So on follow-up, after approximately 14 days of intravenous treatment and Simeox therapy, the patient was in good general condition. His mood improved. He even gained weight a little. The insulin requirement and his appetite returned, and there were no auscultatory changes over the pulmonary fields, and normalization of CRP, white blood cells, and fibrinogen was observed in lab tests. And finally, on follow-up spirometry, give us the reason to be pleased. You can see it on this graph. FEV1 improved about 13% and FVC improved over 12% of predicted value. This improvement was really significant comparing to previous exacerbations. It is clear. And I'm sorry. I'd like to add that because of that, our patients finally understood that the proper expectoration was the key to the success. And what happened further? There was also a follow-up after 2 months of discharge. As you can see, the improvement has persisted. But patient now feels good, his appetite is okay, and he gained weight about 3 kilograms. And for the most important, he has no difficulties with expectoration, which is visible in control spirometry. FEV1 and FEVC are oscillating near the values from pre-exacerbation and near the values from discharge. So, summarizing, I'd like to say that now we have a device who is a new option for our patient. It's worth to it's worth of trying to use Simeox, because we may be surprised in a good sense of that. So thank you very much for this time, and if you have any questions, we are waiting for them.